Hello, I'm Bryan Derman, managing partner at Glenbrook. I'm here to give you just a brief glimpse into some payment trends we're watching in the healthcare space. The healthcare space represents a significant opportunity due to its size and the range of unique needs it contains. Our analysis suggests that in aggregate, the U.S. healthcare system processes over $3 trillion in payments annually. The market can be logically grouped into flows representing transactions between the various key stakeholders within the ecosystem: the healthcare providers, the insurance companies, and the patients, each of which has unique characteristics and challenges. Let's talk about the nature of these flows. We typically depict 8 discrete payment flows within the healthcare space. The inner core of the industry involves a triad of 3 Ps, with monies flowing between providers, payers, and patients, the consumers of healthcare. Flows between payers and patients consist of both the payment of premiums by some consumers buying policies individually, as well as the flow of claim payments from insurers back to patients, usually resulting from the use of out-of-network providers. With the advent of high-deductible health plans and health savings accounts, there's also a growing flow of payments from patients directly to providers. This represents copays, coinsurance, and other costs subject to deductibles. Finally, there's also a very large flow of claims payments coming from the insurers directly to the healthcare providers as they submit claims for the services they've provided. But there are also some significant payment flows happening just outside this core triad. For example, the single largest payer of healthcare claims is not a private insurance company, but the U.S. government itself through the auspices of the Center for Medicaid and Medicare. While some patients are increasingly buying healthcare policies individually through state-level exchanges, the largest payers of healthcare premiums remain employers, unions, and other employee groups who make premium payments directly to the health insurers. Finally, medical providers pay significant sums every year to their medical suppliers, the companies that manufacture the equipment, prosthetic devices, and consumable goods like bandages and syringes. I'd like to highlight just one of these flows, which we've recently become involved in sizing. We expect to see continued attention paid this year to the large flows from private insurers to the medical providers. We estimate this to be a $700 billion market overall. A large portion of that volume is concentrated in flows between the very large commercial insurers, the United Healthcares and Blue Cross Blue Shields, and the major regional health systems, often formed around hospital systems. However, the U.S. healthcare system remains relatively fragmented, with a still large number of smaller insurers and third-party administrators needing to pay claims to a very long tail of small healthcare providers, which for some payers can number in the tens of thousands or even over 100,000 payees on their vendor files. Legacy systems are still fairly common in this space, resulting in what we estimate to be as much as 1/3 of these payments still occurring via paper checks. Clearly, there's an opportunity to replace checks with digital alternatives that would be less costly, faster, have lower fraud rates, and fewer administrative burdens. And a number of both traditional and emerging fintech players are trying to address this issue. Payers and providers interested in making the shift should look at alternative payment methods like virtual cards and real-time payments and speak with their payment providers to understand which transactions could viably be shifted to these alternatives. What other opportunities exist in healthcare? Well, there are many. If you're a healthcare organization or a payments organization working in the healthcare space and want to talk about opportunities for improvement, please reach out to Glenbrook.